Hello. I hope everybody is having a safe election day, but we are still fighting this worldwide pandemic, and now's the time we come together, Monday through Thursday, and remember that we're going to get through this, and we're going to get through this together. We're going to have a very short report today because I know people are focused on the election. But it continues to be a very difficult time in the Commonwealth where every day things appear to be getting worse and more concerning. So today we have our sixth highest day overall with 1,795 new positive cases of COVID-19. That brings our total cases since March the 6th to 111,379. We have 255 kids 18 and under that tested positive just in this report. So we continue to see not only a surge in the virus, but more and more of our kids by percentage getting it. This is going on not just in our Commonwealth, but in our country. To give you an idea, Wisconsin, which is surging, only 25% larger than Kentucky, 5,771 cases today and 52 deaths. Here in the Commonwealth, we continue to see numbers of hospitalized Kentuckians going up 1,037 as of today. At the time that this report was finalized, 259 Kentuckians in the ICU. Since the time we finalized the report, 20 additional Kentuckians have been submitted to the ICU. Very concerning rise in these numbers. 116 Kentuckians currently on a ventilator. Our positivity rate today, 6.24%. Again, we continue to see COVID-19 hit Jefferson and Fayette County hard, but spread absolutely everywhere. So new cases by county, Jefferson 414, Fayette 107, Warren 68, Laurel County 67 cases just in this report, Boone 57, Kenton 50, 40 in Campbell and Hardin, 38 in Madison, 36 in Davis and Pike, 31 in Bullitt and Whitley, 25 in Henderson, 24 in Nelson, 23 in Floyd, 21 in Hopkins and in Rowan County, 20 in Jessamine and McCracken, 19 in Breckenridge, Christian, Knox, and Montgomery, 17 in Boyd, McGoffin, and Monroe, 16 in Barron and Greenup, 15 in Caldwell, Oldham, 13 in Franklin, 12 in Harlan, Pulaski, Scott, and Taylor, 11 in Bell, Marion, and Rockcastle, and 10 in Graves, Jackson, Marshall, Trigg, and Webster. Today, we're also announcing that we have lost 11 additional Kentuckians, due in part to the coronavirus. That brings us to 1,503 deaths, over 1,500 Kentuckians that we've lost. That is a grim milestone, and it appears that we are going to lose a significant number of additional Kentuckians unless we pick it up, unless we do better. So there are now 1,503 families that had to go through a very difficult passing, probably not being able to see their loved one much, if at all, and very difficult remembrances where not everybody can get together the way that we usually remember somebody after they've passed away. Let's support these families with our green lights, with ringing our bells like we do in the Capitol Rotunda at 10 a.m. every morning. Today's deaths include a 71-year-old man from Hardin County, a 91-year-old woman, and an 86-year-old woman from Jefferson County, a 76-year-old man from Montgomery County, a 94-year-old woman, a 59-year-old man, and a 92-year-old woman from Jefferson County, a 71-year-old man from Muhlenberg County, a 78-year-old man from Ohio County, an 82-year-old woman from Muhlenberg County, and an 88-year-old woman from Monroe County. Again, I know people are focused on the elections today. When you wake up tomorrow, I hope you realize that no matter who wins or who loses, We are still at war with this virus, and we're going to need your effort no matter the outcome. This virus isn't going away the day after the election, the day of the election. It is continuing to surge. So let's remember tomorrow, we are all Americans. We are all Kentuckians. All of our actions impact everybody else. I need your compassion. I need your effort. And I need you to be a part of Team Kentucky working to protect those around us. All right, we will move into questions. We're going to have 3 reporters ask them live. I have 1 written question. So we'll start with Tom Latek from Kentucky Today.
Good afternoon, Governor. Did you ask for Commissioner Rodney Brewer's resignation, and could you describe the process of looking for a successor?
The State Police Commissioner, Rodney Brewer, has submitted his resignation effective as of tomorrow. He has spent decades in public service, and we thank him for that service. The process in moving forward is we will have an interim commissioner. He, I think, is very focused on ensuring that we not only deal with the current situation in looking at training, but we know that we have work to do to continue to make sure that the Kentucky State Police operates at the very highest levels. We will be conducting a broader search for a new commissioner, but I want the public to know that I've heard from so many active and former KSP troopers who, to a person, say that this training is not who they are, is not who the state police is, and that they are committed to ensuring that something like this not only doesn't happen in the future, but in conducting themselves and the way we conduct law enforcement through the Kentucky State Police with the highest professionalism and respect. All right, next we have Karen Czar. I think we have Karen.
Up there. Good afternoon, Governor. We have several countries, we have several cities across the country who are boarding up with security concerns regarding the election results. Have you gotten word from any cities that have concerns, or are you hearing about any activity that you need to be worried about?
So I have communicated with our Homeland Security Office, which runs the Fusion Center. Right now, we see, no credible concerns of unrest here in Kentucky. Haven't communicated with other cities on what they're looking at right now, but I think Kentuckians are really focused on what appears to be a record turnout here in Kentucky. And there are those that will be upset or happy with outcomes, but I believe that this election will be one that is good for democracy and shows that Kentucky can be a model. When we reach a bipartisan agreement between a Republican Secretary of State and a Democratic governor, guess what happens? Most people vote, I believe, in the history of our Commonwealth. It shows what happens when we make voting easier. So we need to put these changes into state law. I think that everybody would like to see that because everybody liked some part of what it was, whether being able to vote absentee, by mail, or being able to vote early. So let's not pick and choose based on party or who is more likely to vote here or there. If it created the biggest turnout, which we're seeing, let's put it all into state law. Let's say that everybody's vote matters, whether they agree with our point of view or not. I mean, that's the bedrock of democracy. All right, we got Debbie Yetter next from the Courier-Journal.
Hey, Governor. Can I ask if you asked for Commissioner Brewer's resignation because of the incident with the training manual, and have you become aware of any other incidents in which such material may have been used?
With regards to the commissioner, he submitted his resignation. He has given decades of his life in service of the Kentucky State Police. I've known him for 34 years, and so I'm just going to thank him for his service. That's what he deserves. So we are conducting a top to bottom review of training materials. We have identified at least one other PowerPoint that appears to contain some of the same information from the same trainer. We have not yet been able to determine whether it is a different version, whether it was provided at a different time. We want to make sure we get answers to all of those questions, because we want to be able to look backwards and say, well, how many people went through this, and figure out how they perceived it, and to make sure we can right any wrong there. But then the review going back is also going to help us to ensure that we have the right training moving forward. I think our interim commissioner is committed to doing that, and I think that every response I have seen from, we got a lot of former state troopers that are sheriffs and others, is that this absolutely wasn't right. It's not reflective of how they were trained, but we got to make sure that we have the very best of the very best in looking into the future. The other thing we have to do, and this is across law enforcement, I think every group of law enforcement would tell you this, is make sure that our law enforcement units better reflect our communities in terms of gender, race, and religious affiliation. And so you will see in our budget as it comes up that we're going to put real dollars behind that, because we're already short-staffed in the Kentucky State Police. I want to make sure that we have the resources to truly make a difference in that area moving forward. I have a question from Fox 17 News in Nashville, working on a story about increased cases in Kentucky and wondering if there's any medical insight on where the surge is coming from. Also, what changes the governor plans to stop the spread. For example, will the statewide mask mandate be extended? We're seeing community spread in virtually every county. That means there's not just one thing that we can point at. That's why we have put out our red zone recommendations, which are, when you add them to the school recommendations and to the long-term care recommendations, a comprehensive plan for each community to lessen the spread in their community. But it also puts responsibility on that community, which we believe is the best way to get the buy-in and the compliance that we're not seeing enough overall. Again, we can't, it's not enough for me to stand up here and say we can't be doing that. It's not. We need to make sure that when people are thinking about their actions, they're thinking about their neighbors. And that maybe it's hard to say as a one Kentucky, we need to lessen the cases, but you know, as a one city and one county and as one community, we need to do that. Our red zone recommendations and what we're doing is online at kycovid19.ky.gov. One thing, though, I do want to make sure people continue to be cautious about is family or social gatherings. We're seeing a significant amount of spread there. There was a study about also when one member of a family gets the virus, how quickly it spreads to others. And let's dispel any myth that kids don't get this. I mean, we have 255 kids that are COVID-19 positive just in today's report. All right, we'll go back to Tom.
All right, thank you again, Governor. A couple weeks ago, Auditor Harmon issued a report in which he says a number of counties are non-compliant with state ethics laws for local governments, and that state law requires DLG to inform state agencies to suspend payments to those local governments until they come into compliance. Have you instructed DLG to do that as state law states?
Well, I'd want to review that audit, because I know that DLG under that state law doesn't have the means to specifically go to a county and say you need to put it into effect and you need to follow it. I do think what the audit showed us is that our counties need to really take a close look at whether or not they have their policies and whether they are following them. But that's something, Tom, that we can follow up with you on. I'll touch base with DLG and we will get back to you. Karen?
Thank you, Governor. 2 school districts here in Central Kentucky who are in the red zone are continuing with in-person. What's your response to their decision?
I think they're making the wrong decision. Some have said, well, schools aren't creating the surge, and that's true. We don't think that schools are the driving cause in these communities, but when you are already red, you have that much in your community, schools can amplify it. In other words, if you are red because you have so many cases and you get more people together, you're just going to continue to increase that spread. And that community is not going to be able to lessen their numbers in a meaningful and long-lasting way if we only have a couple groups at the table trying to do it. And not just a specific school system, but in different examples, in the vast majority of places, we're seeing people say, okay, let's grab a hold of this, let's protect our community. But in others, you see denial and rationalization. Oh, it's not my side of the city, it's their side of the city. Or, oh, it's just, we had one state elected leader that said, oh, well, all the cases in that county are in a prison and it's locked down. Well, there's 300 people that go in and out of that prison every day, many of which who have tested positive. So we need people on board, not trying to find a way around it. And yes, it's hard, whether you're a school system or local government or a business, and you say, we're going to have to go virtual. Yeah, it can hit you with dollars. It has difficult repercussions. Nothing about COVID is easy. And there's no decision or recommendation that I can give where we're gonna defeat the virus, but we're not gonna have to change our lives, or it's not gonna take a human toll on us. This is a mean virus, and that's why we're willing to take some real risks, whether it's school or others, when you're in the yellow, and a little less so in the orange. Once you hit the red, if you're not following the recommendations, then maybe there's no number high enough that we're willing to do what it takes. So please follow them. All right, Debbie Yetter, Courier-Journal.
Louisville Mayor Greg Beshear and his health director Sarah Moyer today expressed concern that if cases continue to accelerate at the same rate, that they might overwhelm the health system and hospitals in Louisville. Are you aware of that, and are you concerned statewide?
We are seeing in certain areas hospital systems becoming taxed. I believe the Barron County newspaper ran a story about their local hospital being, I think, at about 80%. We are definitely seeing numbers, and just about every hospital system is reporting to us that the numbers of hospitalized Kentuckians is going up, and it's starting to go up a lot faster. Now, we do have a lot of preparation, though, that has gone into how we expand our number of beds when we need to. But if we cannot control the increase, then it is a real possibility that we could face some real concerns with capacity, having enough beds here in Kentucky. And if we do that, what we've seen from New York and Louisiana, Florida, Texas, and Arizona is your numbers of deaths jump up and start jumping up pretty quickly. So we are in regular contact with our hospital systems. And we've seen a lot of really responsible action in a number of them where they will start dialing back some of the other activities they engage in to make sure they have the capacity from all of our healthcare system, from all of our healthcare warriors, from the person doing admissions to the CEO. We have seen a real commitment when it comes down to it to do what it takes to defeat this virus. They have been on Team Kentucky the whole time, and I can't thank them enough. So again, everybody, I know it is election day. I hope you voted. I hope you voted safely. You had more options than ever before. Seems like a good idea to continue this in the future. But remember, there are real enemies out there, and the enemy is not each other in a great country where we get to express our desire for leadership through our vote. Please, when we wake up tomorrow, remember, we are still in the middle of this coronavirus pandemic, and we need your help. Thank you.